Right. Hello. Good evening. Afternoon. I'm not entirely sure of the time zone that everyone's in, but wonderful to be here. I'm Dr. James Galloway. I'm a physician, a rheumatologist from London, from King's College, and over here doing an MRCP. And I just will take a short minute of your time. The MRCP exam. So this is the Royal College of Physicians exam in London. It's a UK exam that doctors in the UK will take to go on to practice in any of the medical specialties. The exam's been running for a long time. The college was founded in the 1700s. It's the exam, so in the UK, once you've left medical school, everyone will do 1 to 2 years as a foundation trainee. So that's their sort of equivalent to your internship over here. Once they've completed that, they'll then go on to a specialist training, which would be medicine, surgery, family medicine. If they're going to do one of the internal medical specialties, they'll usually train in what's called a core medical training pathway, which is 2 years, which will take 4 months at a time doing different specialties, gastroenterology, cardiology, rheumatology, and as you go through those in that 2-year period, that's the point at which doctors will sit the MRCP exam. And it's a good exam. It's an exam that's, I think, well designed in terms of preparing people for internal medicine practice. It's difficult and it differentiates candidates who are good and not so good, and it's internationally recognised. And I'm delighted to be here in India and seeing people interested in over here. The exam is in 3 parts. It's got 2 written exams. The first written exam, which is a relatively basic science-orientated exam, so best sat as soon as you've left medical school, and if you're paying for other postgraduate exams, it's ideally placed there. The second part is a written exam that's much more clinically orientated, around best practices, guidelines, challenging diagnoses across the internal medicine specialties. And then there's also a clinical exam, the PACES exam, which is a practical exam where you are expected to see patients, examine them, and come to a diagnosis. And it's probably the most challenging part and the hurdle that is most difficult to get over. And one of the things that has really kept the exam in the sort of a very esteemed exam worldwide. And the exam is been available worldwide for a long time. There are exam centres that do MRCP across the globe. I'm aware that I was just watching beforehand. You had a fantastic looking talk. I don't want to interrupt your discussion around tryptophan pathways. And so I'm going to hand back, although I'm aware that I think everyone has left me in here alone, but I'm going to hand back to your team at DAMS. And my final word is, I've been absolutely astonished with the quality of medicine over here. Many of you may or may not have been to the UK. One of the things I'd say about the UK, I've spent a long time, many years teaching UK graduates, and I've spent a lot of time teaching graduates from overseas, and just today as well I've been teaching MRCP to DAMS students. There's no doubt the quality, the standard of knowledge from Indian graduates is superior to that we have in our homegrown graduates. It's embarrassing to say that, and that's not, I don't want to be rude about my colleagues, but I've been very impressed by the quality of education out here. So I will hand back. Thank you very much for listening. I'm sorry to have interrupted your classroom session.